Good evening. One of the most stressful activities that I do regularly is cooking pasta. Whenever I go to drain the noodles using a colander into the sink, I go very carefully, gripping the pot tightly, making sure not to spill any of the water. My heart tends to race, my hands get a little bit sweaty. It creates a great amount of anxiety in me. Even though many people cook pasta and it's no big deal, for me it holds a particular amount of terror. This has to do with an incident that happened a few years ago. My husband was cooking pasta. He was going to drain the noodles into the colander, and our daughter was standing near him. The pot slipped out of his hands, and the nearly boiling water fell onto my daughter's cheek, shoulder, and leg. We had to call the ambulance, and we were at the ER for several hours. While she did recover very quickly, now whenever I cook pasta, it's what I think about, and it causes me anxiety. This is a very mild form of post-traumatic stress disorder, otherwise known as PTSD. Post-traumatic stress disorder is when our nervous system attaches certain stress reactions to memories. So when we remember something that was traumatic, it makes us feel like that's going on currently where we're at. It activates our fight or flight system, and even though it's just a memory or something related to a memory, we suddenly feel all the emotions and the physical reactions that we felt when it first happened. This disorder is prevalent in about 8% of the population. People will have it at different times in their lives and different amounts of severity. Healing can happen with PTSD if right after trauma, the traumatic incident is processed in a healthy way, such as talking to a trusted advisor, a close friend or family member, and basically processing it to get a good context for what happened. And sometimes people can do that effectively and it doesn't become a disorder. When it does become a disorder because it was not quickly treated after the incident of trauma, or if the incident of trauma was ongoing, such as long-term childhood abuse, that's when we get the symptoms of a disorder, and we have to use therapy to treat those symptoms. There's a variety of types of treatments for PTSD. The first one I'm going to talk about today is prolonged exposure therapy. This is the type of treatment where a therapist takes a patient and gradually exposes them to things related to the trauma. Over time, the patient will see these things as less terrifying or less anxiety-inducing. A good example of that that's relatable would be, as a child, the first time you watch a horror movie or any sort of scary movie, it was probably super terrifying. But yet as you get older, the more you watch those type of movies, the less they affect you. A specific example for this type of therapy would be when a car crash survivor has such an amount of anxiety about driving that they can't drive at all. They would go to a therapist. They would do the prolonged exposure therapy by having the patient sit in the car at first, and then over time they would start driving a little and then driving longer distances, and just gradually build up a normalizing of that issue. The second kind of therapy that's highly recommended is cognitive processing therapy. This therapy focuses on the thought processes related to trauma. Often, survivors of trauma will feel feelings such as guilt or shame. They might feel like they're a damaged person that can't be fixed. They might feel like they're at fault somehow. And cognitive processing therapy, or CPT, will make them, the therapist will help them to question those thoughts and bring about new thought processes that help them to get a better context for the trauma. So specifically for someone who has survived sexual assault, it's something that the therapy would be focused on reminding the patient that they are safe now, reminding them that they are not at fault, and reminding them that they are a whole person with value. The main focus of CPT usually is safety, power, trust, control, esteem, and intimacy, according to APA.org. It also has a specific timeline. CPT is only usually about 12 weeks long, which, when you compare that to talk therapy, that could go on for years. Just classic, sitting on your therapist's couch. That could go on for as long as the patient and therapist want. Whereas CPT is a strict timeline that allows the patient to come in, get their resolution, and then be done and move on with their life. The last kind of therapy I'm going to talk about is called eye movement desensitization and reprocessing, or EMDR. It's a really unique sort of treatment. It's very different from the other types of treatments that most people think of when they talk about going to counseling or therapy. This one is more related to brain functions rather than thought processes. So with EMDR, the therapist will take a history of their client, get to know them, kind of prepare, and then they'll recall specific traumatic memories, and then they'll do a process called bilateral stimulation. It sounds really complicated, but I'll just show you what it is in the video. It's actually really simple. This is a session of EMDR, probably reenacted due to privacy issues, but it shows the basic actions that the therapist, who's the woman, is doing to do the bilateral stimulation. So what she's doing there, it might seem strange, but she is just moving her hand and having him track it with his eyes. And researchers have found out that there is some sort of connection between trauma and these eye movements. It doesn't really make a lot of sense, but somehow our brain has the two issues of these memories and the eye movements connected to where when we do these eye movements while recalling the memories, it kind of repacks the memories away in a way that lets our nervous system kind of disengage from them. Whereas when trauma survivors have a memory that causes them anxiety or depression or stress or panic, the EMDR will allow the patient to still have the memories, but it kind of just lets their nervous system move on from it, and it just becomes a normal memory like anything we remember from a different time. It's a little bit kind of mysterious in how it works. The creator, Francine Shapiro, discovered it just in considering her own traumatic memories, noticing that her eyes were moving a certain way and that she felt better after that happened. And it's like CPT, EMDR is also a specific length therapy. It only takes about 6 to 12 sessions depending on the severity of the trauma. And it just allows the patient to come in with their trauma, regardless of what the source is, and just kind of move on from it and then move on with their life. I think those kind of therapies are really important because people can spend a lot of money going to talk therapy for many years and not get much of a resolution if they're just kind of talking about stuff. But these specific trauma therapies that have very careful, laid out plans are really much better for people so that they can just get the resolution they need and then move on with better functioning. As I mentioned earlier, around 8% of the population will experience PTSD at some point in their lives. And there's probably quite a few students in this class who have some form of it. And I think that it's really important for us to understand that there's a lot of treatments out there, and there's a lot of really effective treatments out there, and particular ones to fit each person's specific needs. And I hope that people will take time to look into those options so that they can function better and have a better outcome for their life. Thank you.